That's right. If you know what these are, you probably have questions. Whether it's Wegovy, Monjauro, or Ozempic, injections are a real way to lose weight. Today, I'm going to walk you through the most commonly asked questions I get about injections. So let's talk about what these are. I'm Dr. Harpreet Tsui. I'm board certified in internal medicine and obesity medicine, which makes me qualified to tell you what these are all about. Let's look at this one. So Monjauro and Zepbound, also known as tirzepatide. This is a drug that uses two peptides to help in weight loss. Wegovy and Ozempic. This is also known as semaglutide. This uses one peptide to help aid in weight loss. The way that these drugs work is they act on your GI system. So they help keep you fuller faster, you get fuller longer, and you slow down your digestion. Thereby, you're really not eating as much food as you were, and then that gives you that weight loss. Who should take these medications? Diabetics, those who are struggling with their weight, and those who have a BMI of 30 or higher. Who should not take these medications? Those with a BMI of 29 or under, those with a family history first-degree relative of medullary thyroid cancer or MEN type 2 syndrome, and those with pancreatitis history. All right, come with me. When you're doing your injections, there's three places you can inject. You can inject here in the back of your arm, you can inject into your abdomen, or you can inject into your thigh. I will say, out of all three spots, behind your arm is the hardest one to do on all of them. So when you get your Ozempic pen and you take the cap off, you're gonna see that there's not a needle on it. But your box will have come with some pen needles, which are quite small. So the first thing you wanna do is you want to twist the needle onto your pen. Before you remove this cap, you want to dial up the dose appropriately of where it needs to be. Once that's done, you can take the cap off. As you can see, the needle is very small. If you're going to inject it in your abdomen, I say the easiest way to do it is to grab a little pinchy bit down here. And then what you're going to do is use some alcohol to wipe it down. And then when you go to inject, you're gonna insert the pen and you're gonna depress this button. After you depress the button, when you hear the last click, you're gonna count to 6, and then that makes sure that all the medication goes into the abdomen. You're gonna take this off. You are not going to recap this needle. You're going to take this off and dispose of it. Moving on, the next drug is Wegovy. So Wegovy is interesting because it's an auto injector. Everything is built into the pen. Really great for those of you who are a little bit needle phobic. What you wanna do is you wanna take the cap off. That goes in the garbage. Pick your place of where you'd like to inject it. Again, if you're going to do it in your abdomen, you're going to wash the area with a little bit of alcohol. And then this is an auto injector. Inside here is a little yellow bar. That's the one that you're going to want to watch. So you're going to inject, and I'll demonstrate it on my arm so you can see. You're going to put it here and you literally click down. And you're going to watch this yellow bar and you're going to listen for that second click. Remove it, and then you can dispose of the whole thing. Now let's move on to Monjauro or Zepbound. This is also an auto injector, but it works a little differently. As you can see, there's a key that's either locked or unlocked. If I try to unlock it, I can't because the cap is still on it. So the first thing you want to do is you want to take the cap off and you want to unlock it. Now it is primed and ready to go. This is very similar as our other injection pens, but there's a button on top of it. And this one is interesting because you're going to hear 2 clicks as you're injecting it. So you're going to pick the area where you want to inject, and if you're going to do it on your abdomen, right, I recommend that you grab an area of your abdomen to give you some stability. What you want to do is you want to place it on your abdomen, and then you're going to click the button on the top. And you hear that first click, and then you're going to hear a second click. And then you know it's done. And so then you can take this entire thing and dispose of it. For all 3 of these pens, it's the same injection process for no matter where you use it. So if you're gonna put it on your thigh, put it there. If you're gonna put it in the back of your arm, place it right there. Now stop. These medications are great for curbing your appetite, but sometimes that's just not the problem. Your body composition is critical to your weight loss success. It's okay if it's hard. It's okay if you're frustrated, if you've plateaued, if you've done this before and failed. You can be successful with the right people in your corner, and I will be here to celebrate every small win, and we can do this together. Now,